Hello and welcome back to my channel. My name is Dr. Shanai and my channel name is Direct from Doctor, which deals with all the health issues. I'll be giving a lot of information on various health conditions and what you should do and certain tips about health. So please follow my channel, please share among your friends and please support my channel and please subscribe and ask your friends also to subscribe. Thank you. So today I'll be talking about one of the most common things what's happening. So that is called as a heart attack. Heart attack is still the number one killer in the world. Approximately 7 million people suffer from heart attack, and certain percentage, maybe around 30%, die of heart attack. So there is a bit of confusion among the public what exactly is heart attack and what is cardiac arrest. Say there are two things that can happen to the heart. Two things may sound similar but are different actually. There is something called as heart attack, there is something called as cardiac arrest, and there are several other things which I will not discuss today. So today I will discuss only about the heart attack and the difference between heart attack and the cardiac arrest. Say, first of all, let's understand what exactly the heart does and why the functioning of the heart is required. What happens in a heart is a small, about the size of a fist, which is located on the left side, slightly to the left side of the left upper side of the chest, and a bit to the middle to the left. So the heart is actually a sort of a muscular pump. It's literally a pump. It pumps the blood 60 to 70 times or a little more, as a condition maybe, if required. And it pumps so powerfully so that it runs all along the arteries and it oxygenates, it carries the oxygen and all the other nutrition to the tissues and cells up to the cellular level, and it comes back from the veins. It is pushed through the arteries and it comes back through the veins. The impure blood, it comes back through the veins and it comes back to the heart. From the heart, it is pumped to the lungs. See, we are breathing through the lungs, right? 16 to 20 times a minute we breathe. So we breathe in the oxygen and breathe out the carbon dioxide and certain other impurities. So we breathe in the oxygen, so this oxygen is collected by the blood. So the blood which has come from the heart to the lungs, it collects the oxygen and it from there again it pumps through the arteries and it again circulates, comes back to another chamber of the heart through the veins, and again that impure blood is pumped to the lungs, and as we breathe out, all the impurities will go out, like carbon dioxide and certain other traces will go out through the lungs. So lung is a sort of a machine which takes in the oxygen and sends out the carbon dioxide and certain other impurities. So this is in brief the function of the heart and with the help of the lungs. So mainly it's a main part of the circulatory system. Circulatory system is circulation of the blood. So the blood carries the oxygen. The blood carries oxygen and other nutrition to the tissues, as I said. So this is a fantastic cycle going on, and by the heart pumps around 60 to 70 times, a little more, and lung assists in supplying the oxygen and also to take away the impurities and send it out through breathing, right? So this is in brief the function of the heart and the lungs, right? So what happens is heart is completely a muscular organ, right? Heart is a muscular organ and full of muscles. So these muscles also require the blood supply. Heart pumps the blood and collects the blood, of course, but the thing is, heart itself requires the blood to survive. The heart muscles, like any other tissue, heart muscles also require the blood. Sometimes what happens, this blood is supplied through certain arteries. Sometimes what happens is one or more arteries supplying the blood to the heart muscles get blocked. So imagine a water hose pipe. You block something into it, something gets blocked into that, some impurities. Suddenly the water may stop, right? Similarly here, some certain blocks in the heart. it may be 80%, 90%, sometimes 100% block. So the blood doesn't pass through. Doesn't pass through. Even if one heart is blocked, there is a shortage of blood to the heart, muscles. I'm talking about the heart. Blood supply to the muscles gets affected, and muscles suffer. And virtually part of the muscle becomes damaged. So this is called as heart attack. So this can happen because of one or more arteries getting blocked, and which could be really dangerous. Sometimes what happens is the block sometimes gets the blood somehow manages to get through, and the person may feel comfortable again, and may think that nothing has happened, and may continue for months or years, without any problems, and again it may occur, the same problem. So why these blocks occur, and why suddenly sometimes some people feel this problem, and suddenly why the heart attack occurs. In medical terms, we call it as a myocardial infarction. Myocardium means the musculature of the heart, right? So why it happens? See, most of the times it happens because of our lifestyle, and also because of high diabetes, high blood pressure, and certain other things, and aging. So aging causes what is called as atherosclerosis. Athero means artery. Sclerosis means hardening of the arteries. The arteries actually get hardened. The internal layer of the arteries may easily get flaked. We call it as a plaque. Plaques may form inside the arteries because of the damaged portions, dry portions of the arteries, and it may accumulate in certain areas and certain points. And when there is some problem, like the person is overstressed, or sudden high BP is there, or during certain, even as it is sometimes, these accretions, so accumulated things, it just breaks loose, and it may go to another part of the artery, and it may block the blood from flowing. So this is actually what happens actually. But this clogging of the heart can happen even without atherosclerosis. See, nowadays we see heart attacks in younger people. So earlier it was commonly seen in people above the age of 60 or 70. Nowadays we see suddenly the person having it at the age of 30, 35, 40, 50s. We hear so many instances where these kind of things are happening. So what we can do about this? So we have to modify our lifestyle. That's the first thing. It's not easy as said. And also, if the heart attack happens, what can be done? So usually what happens is the patient must be taken immediately to the hospital. The nearby relatives or whoever is present have to take the person to the hospital. So what happens is, in some cases the patients may die, because in heart attack, or MI, what we call it as myocardial infarction, there are types actually. When certain portion of the heart gets damaged, usually the damage is minimal, and the person may survive. Only 10% of the people die. But there are certain areas of the heart which get damaged. In that case, the person may die immediately, or may die in minutes. So the time is very crucial in this case. So the person has to be taken to the hospital, and the doctor has to be told, and the doctor will examine through regular means. Also, the doctor will do what is called as ECG. ECG is nothing but electrocardiogram. So I'll explain what it is later. So through the electrocardiogram, it shows the patterns. It shows the electrical patterns inside the heart, and certain nodes and all that. I can't explain the technical things right now. So these will be seen, and it will be printed out, and in the printout the doctor can see that the person actually had the MI, that's a myocardial infarction or heart attack. The doctor also may do what is called the echocardiogram if the time permits, or else the doctor may immediately recall what is called as interventional cardiologist. Interventional cardiologist will do what is called as angioplasty. Angioplasty means, angio means in an artery, blood vessel. So the doctor will pass a thin wire, a very thin wire, a medical grade wire. So through, it may be through the wrist, through the wrist, artery through in the wrist, and pass it all along up to the heart, all along up to the heart where the blockage is there. So he'll be seeing that in a monitor and the whole procedure. So he knows exactly where to go. The wire goes up to there, and from there a balloon is passed, and the artery which is clogged is opened up because of the inflation of the balloon. Actually, a balloon is inserted, and in that particular portion the artery is opened up, which is clogged, which is opened up. So immediately the blood starts flowing again. All right. So later it has to be supported. So whatever is expanded has to be supported. So he will insert a mesh. It's a mesh, okay, mesh, a small mesh, a tiny mesh will be inserted, and it's placed in that area, so it will hold that artery in place, that particular opening in place. So which is the artery which is expanded, it is held in place. So that mesh is left as it is. So it may be medical grade mesh, it's laced with the medicines, or it may not be laced with the medicines that the cardiologist will decide. So there is another procedure. Sometimes angioplasty is not possible. In some persons, it's not possible. So there are certain technical problems. The blockage is total and it cannot be opened, or the wire cannot be inserted. There is so much narrow artery, and so many other things. In that case, a cardiovascular surgeon may perform what is called as a bypass surgery. Bypass surgery means, you imagine a road, under repair. So the traffic is stopped there. So the authorities may make another bypass road from the one point to another point. They may curve, and they may create a bypass road. Similarly here, the doctor will graft a small piece of artery or vein which is taken from another area, and it is grafted from one point of the artery to the another point of the artery, bypassing that block. So this is called as bypass surgery. So bypass surgery is slightly more severe kind of a treatment. If angioplasty is more simple, angioplasty and stenting. Stenting means that mesh which was inserted. It is called as a stent actually. So the stent will be there permanently. It's a relatively simpler procedure. And to see the block, they do the angiogram. So that is angiogram or angiograph. That is called as that is to see the block actually on the monitor. And because of with the help of that, they will insert that wire and put the stent, wire mesh stent. Okay. So in bypass surgery, it's actually grafting another artery. So that will take up absolutely no problem. But the patient has to be in the hospital for a longer time. In case of angioplasty, sometimes the patient is discharged the very next day, or if old patient is kept in the hospital for 4 or 5 days, and later certain drugs are prescribed. Drugs are prescribed so that the clotting of the heart blood is minimized. Because further clots may really complicate the issue. So what happens is the patient is put under certain anticoagulants. We call it, in layman term, we call it a blood thinner. Actually, it doesn't thin the blood. It sees that the clot is not easily formed. So low dose of aspirin, say 75 mg, or in some certain Western countries they prescribe 80 mg. Here in India we prescribe around 75 mg per day, usually taken in the night time. And also another anticoagulant, antiplatelet we call it as, because platelets in the blood is one of the components of the blood. Platelets cause is one of the main things for the clotting of the blood. So platelet accretion means accumulation of the platelet is prevented by certain other drugs. Example is clopidogrel, and there are certain other medications. And usually a statin is prescribed. Statin means it's an anti-cholesterol drug. So say cholesterol is one of the reasons, in addition to other reasons, which may contribute to the clogging of the heart, clogging of the arteries, supplying blood to the heart. So the person will be asked to go on a slightly lower cholesterol diet, and certain other kind of diets are prescribed to the patient. Uh, so these statins, usually what happens is the cholesterol, usually the metabolism or the manufacture of cholesterol usually happens in the night time. So that's why the doctor advises the statins to be taken in the night time usually, because in the night time usually this manufacture of the cholesterol happens. So nowadays everybody knows that cholesterol is of two types, LDL and HDL, and LDL is dangerous, HDL is good. It's a good cholesterol. LDL means low density lipoprotein, and high HDL means high density lipoprotein. High density is good and low density is not good. High density literally pushes the LDL, which is it may make clanging onto the internal surface of the arteries. All right. So then the blood pressure has to be kept under control. If the patient is diabetic, diabetes has to be kept under control. So these are all aftercares. And daily some mild exercises will be prescribed, which the patient is supposed to do after a couple of weeks. Patient cannot drive the vehicle for a couple of weeks, and later the patient is allowed to drive after a couple of weeks usually. So the doctor will examine and tell when exactly the person can resume the normal duties. Usually a couple of weeks the patient should be back to the normal life. So the patient is advised to walk a lot, at least half an hour a day, 30 minutes a day at least, 5 times a week at least. A little more walking is also good, but no strenuous exercises. So this is usually the regimen. So once the angioplasty is successfully done or the bypass is done, if the bypass is done, the rest period is more. The doctor will decide. It has to take up, and the graft has to be successful, and the patient may be kept in the hospital for a longer time, right? So this is all about heart attack. Briefly I've told, not to explain much what exactly is needed to be learned by the common people. I've told some other details I'll tell in the future videos. So this is in brief about the heart attack. Sometimes the heart attack may be so silent, we call it a silent heart attack, that the classical signs will not be there. Otherwise the classical signs of a heart attack is sudden weakness, a terrible weakness comes, and there may be pain or there may not be pain. There may be tightness in the chest, in the middle of the chest, a tight feeling, very tight feeling. There may be pain radiating to the left side of the shoulder and the arms. Sometimes to the right side also. Left side is more affected usually. And sudden the jaw pain, lower jaw. Under the jaw, some sort of a pain or tightness may be felt naturally, because of all the arterial network not getting sufficient blood. Sometimes the patients confuse it for dental pain and goes to the dentist. Dentist doesn't find anything, but dentist will ask if it's occurring too often. If it's occurring too often without any obvious reasons, the patient will refer the patient to the cardiologist. The dentist will refer the patient to the cardiologist, and thorough examination has to be done, whether any blockage is there, any kind of signs of heart attack is there. Sometimes heart attack may come and go without any warning, and patient may survive for some time. So this is called a silent heart attack, where classical signs are not there. No classical signs. Patient may feel that there is a small stomach upset or something, a bit of breathlessness or something, and it goes away. So the patient is okay. The patient feels happy that is fine. But later on, some other day, the patient meets with a massive heart attack. Massive heart attack means a lot of musculature of the heart is affected, and the patient may die. So in the heart attack, there are chances of patient surviving if the timely treatment is done. But on the contrary, I was telling about cardiac arrest. Cardiac arrest, there are bleak chances. Only about 10% of the people survive in cardiac arrest. In cardiac arrest, what happens is heart stops work. It's something like electricity switched off suddenly. Nothing happens. Heart is dead almost. Dead means it stops functioning. Okay. So in heart, there are certain electrical impulses which are passing, which makes the heart work. those electrical, the natural electrical impulses, for that electrolytes are required, and I'll tell about that in the future. So what in the food and fluids what you consume, certain electrolytes are required. There's a reason to keep our health going well. So suddenly the heart stops pumping. It's still, okay. That is it. If the blood is not pumped, what will happen? The tissues will not get any fresh oxygen, right? The patient will die within minutes. Okay, so cardiac arrest is more dangerous, much more dangerous. And if there is anybody in the vicinity, if the person is trained, they have to immediately perform what is called as cardiopulmonary resuscitation, pumping of the chest and all that. That I'll explain later. You will find a lot of videos in the YouTube how to do CPR. CPR means cardiopulmonary resuscitation. If the patient is in the hospital and if the cardiac arrest occurs, he'll be put under a defibrillator, we call it. Certain the machines which are kept on the leads and which are kept on this area of the heart, and certain current is passed, and it starts defibrillating, what is called as, and the heart may be revived. So for the cardiac arrest, immediate treatment is required, otherwise the patient may die. Most of the time the patient dies. But in heart attack, still there will be chance of survival. If soon the patient is shifted to the hospital, even in case of massive cardiac heart attacks, patient may survive if the treatment is done on time. So please remember, time is more important. Time is crucial. So there is something called as the golden hour. So the first 30 minutes are very, very important after the heart attack. So this is called as the golden hour, where the patient has the chance of surviving with the proper treatment. And the patient, with the proper treatment, the patient may survive for a very, very long time and lead a very fruitful life. So please remember these points. The picture is a bit scary, but don't get scared. Know the things, with a bit of good basic knowledge about this which I just briefly explained about this, not in detail, but this much knowledge is enough for the layman, for the common people. So know about it, and save yourselves and save the near and dear persons, okay, people. So take care. I'll meet you in my next video with another topic. Take care.